The last session for today will be the recent advances of Rhinology, and it will be taken by Dr. Ravi Hemram and Dr. Aniruddha Majumdar.
Hello, good afternoon everyone. So today is Guru Purnima, so my sincere pranam to my all gurus. So my topic is research advances in Rhinology. So research advances in Rhinology mainly divided into medical and surgical management. So my topic is only on the medical management. So what is the recent advances? So few things are going on in Rhinology part. So most of them are basically for understanding of the disease and the etiopathogenesis of the disease, and investigation modalities and medical therapy. And next for surgical management will take over by our another professor Dr. Majumdar. So introduction. Rhinology has witnessed a significant transformation in recent years, particularly in the field of chronic rhinosinusitis. So recent advances are mainly by the diagnosis of the disease. So what is that? So rhinology in terms of endoscopic technique, imaging modalities, biomolecular diagnostic have led the more accurate identification, minimally invasive intervention and improved outcome. So innovations such as image guided surgery, powered instrument, bioabsorbable drug eluting implant, as already mentioned by our previous colleague, drug eluting implant in otology. Here also we found some drug eluting implant, and integration of artificial intelligence and redefining the standard care. So what is the objective? Objective at the end of this class you will be able to understand the common sinusoidal diseases and their pathophysiology in research mode, explore the research advances in medical and surgical treatment, review the modern investigation tool, disease and modalities, highlight the research advances and evidence based practice. So chronic rhinosinusitis. So initially there is a definition. Now primary CRS is now as a localized or diffuse. So it can be divided again in the endotype and phenotype. As already we know, according to the chronic rhinosinusitis with or without nasal polyp in adults is defined as the presence of 2 or more symptoms. So these are if you go through the books you will get all these things. So what is that? In case of endotypes is whether it is type 2 mediated or non-type 2. Non-type 2 means type 1 or type 3. CRS with polyposis. Polyposis is always type 2 mediated, and non-type 2 is CRS without polyposis. CRS may be associated with non-allergic, allergic, it may be associated with some other disease also in asthma. So there is different classification is there. Disease pathogenesis and shift from the phenotypes to endotypes. So CRS with nasal polyps, basically without nasal polyps is non-type 2 inflammation endotype, and CRS with polyp is type 2 inflammatory endotypes. So diagnosis of CRS depend of the there are some tools is there for diagnosis of CRS. One is the SNOT 22 criteria and EPOS criteria is there. So I will not go through all these things. Medical therapy of the CRS, only thing is that there is recent advances. Xylitol is nowadays are added to reduce the symptoms and to reduce the drug dose of any other steroid in terms of topical or in terms of systemic steroid. There is another thing, hypertonic seawater is nowadays using hypertonic seawater along with sodium hyaluronic acid. These are the drugs that are using nowadays as a adjuvant therapy in managing CRS. So and what is the drawback? How it is important? Just because there is something going on inside the basic pathogenesis, pathophysiology where the CRS is associated with the infection. If CRS associated with infection, there is a chances of biofilm is there. So there is something that treating topically prepared nasal and paranasal sinuses with selective laser light. Laser light exposure effectively destroys the biofilm while preserving the normal tissue and reducing the needs of antibiotics. So these are the new things that are coming. Pseudomonas aeruginosa biofilm could be effectively disrupted and the indwelling bacteria exposed by the Q switch of ND-YZ laser. Laser also using as a modalities to treat the chronic rhinosinusitis associated with biofilm. So, methylene blue as a photosensitizer followed by the application of diode laser, it can cure 99.9% of the biofilm bacterial colonies reduction. So, medical management of CRS, number one is a drug eluting device, this is the propel implant, this one is the propel implant and this is the interstice ENT implant. So, these are the implant. So, that is put inside the middle meatus or in the middle meatus area after the surgery, after the functional endoscopic sinus surgery. So, it retract the middle turbinate towards medially. So, there is a chances of less synechial formation and there is a constant drug, steroid is steroid that can 370 microgram of mometasone furet over 30 days, it can release for a month. So, it is very much helpful to reducing the recurrence and along with the complication of the surgery. So, biologics. So, there are some biomarkers are there, so that these biomarkers are effective to diagnose whether the endotype, whether the type 2 or type 1 or type 3. Type 2 always associated with nasal polyposis. Other CRS are associated mainly with type 1 and type 3. So, you have to know some biomarkers so that you can identify the disease first. If there is a type 2 and the therapies, biologics therapies depend on the endotype. So, that is why it is important from phenotype to endotype. So, dupilumab is a fully human monoclonal antibody target IL-4 receptor alpha, thereby inhibiting the both IL-4 and IL-13 signaling. So, dupilumab use is the most commonly reported adverse. There are some side effect also there, headache and nasopharyngitis and worsening of the nasal symptom, asthma may be there. Second was not commonly used, omalizumab is commonly used. This is anti-Ig antibody bind for free Ig, preventing it from attaching the mast cell and basophil. So, it is particularly used in the allergic rhinitis or with nasal polyp. So, omalizumab is used in type 2 type. So, the main side effect is thromboembolic event and frequent common cold. So, these are the other biologics are there. So, indication of biologic treatment, so totally depend upon the criteria. So, there is two criteria, the EPOS criteria is there and euphoria 23 criteria. These two criteria is there for giving the biological treatment. So, first of all you just identify the endotype and after that you can give the biologics. So, defining response to biologic treatment and CRS. So, there is some evaluation criteria, how to evaluate. Initially there is not 22 criteria to evaluate the patient after surgery or after giving therapy. Now, euphoria is the new criteria. So, it is graded as a mild, moderate, severe. Euphoria is the recent one and EPOS there is a mild, moderate, intermediate, poor response and high grade. Biologics in allergic already I discussed, reduce the nasal polyp size. So, criteria to use evaluate the efficiency of biologic therapy to reduce the nasal polyp size, to reduce the need of systemic corticosteroid, improve the quality of life and they improve the smell sensation. So, topical and localized drug delivery advances. So, these are the technique. So, to reduce the incidence of CRS, the high volume steroid nasal rinse, exhalation during steroid system and drug eluting stent and implants. So, histoglobulin in allergic rhinitis nowadays are used histoglobulin, this is also a newer drug. So, there is some technique to give subcutaneous, you have to give 1 ml of injection for a 4 days interval for 1 month followed by 3 injection at an interval of 1 month. So, microbiome and epithelial barrier. So, these are the barriers that basically prevent the drug to enter into the systemic circulation and enter into the tissue. So, you have to know the microbiome is a collection of gene. maybe it's allergy, it may be fungal, viral or bacterial. So, you have to recent discoveries have emphasized that the role of sinonasal microbiome and epithelial barrier that dysfunctional in case of CRS pathogenesis. In dysbiotic states, commensal bacteria replaced by the pathogenic biofilm, leading to persistent inflammation, and treatment targeting these microbiomes such as probiotic and bacteriophage therapy are being explored. So, bacteriophage are nowadays the use in case of CRS also. So, specialized this is the mechanism action artificial intelligence. Now, coming to the imaging modalities. So, in investigation part you know that there are so many imaging modalities. In case of rhinology, what are important is the AI based CBCT and diagnosis of sinus pathology. So, an automated segmentation of maxillary sinus, comprehensive AI application of sinonasal imaging. So, these are the some review work are going on in this field. Basically nowadays not popularized, systematic review is there, or CBCT delivery maxillary sinus, AI tax, there is so many things going on nowadays. Bone remodeling and chronic maxillary sinusitis, mechanism based treatment summary. So, these are the these are the targeted pathogen IL-4, IL-13 signaling, low mechanism low IgE, and therapies are dupilumab. These are the therapy biologics that are used in case of CRS. Now, imagine PET-CT fusion imaging technique, combine anatomical CT scan and PET scan imaging, enhance detection of primary, residual and metastatic sinusal malignancy, useful in staging and treatment. So, 18 FDG tracer are used, improve the imaging resolution, AI based fusion algorithm are used. So, indication advanced stage of malignancy, ulcerative lesion, surveillance of post treatment surveillance, contraindication poor renal function and uncontrolled diabetes mellitus. These are the contraindication of PET-CT fusion imaging technique. So, now 3D printing also used in rhinology, just because to understanding of the disease and the post-operative defect. So, how basically it acts? Basically patient specific anatomical model guided complex sinusal skull base reconstruction. So, you have to, after surgery you have to know how the defect and what is the type of defect and the volume and everything you can identify before the surgery by 3D printing technique. So, allow better surgical planning and flap selection. So, recent advances biocompatible implants are there, hybrid printing, bone and cartilage, these are used for hybrid 3D printing. 3D printing indication large and complex defect, cosmetic and functional reconstruction, contraindication small defects can be manageable by the easy local regional flap, and drawbacks high cost, limited use, low resource setting, long preparation time. Modern rhinology advanced management sinus. So, this is all about the CRS, and now the sinonasal mass. So, these are the classification, how to classify the sinonasal mass, just go through the book. And inverted papilloma, nothing to do. This is the thing that this is the advancement in understanding of the disease. So, subtype of 6 and 11 are associated with benign papillomatous lesion, while staining 16 and 18B are considered oncogenic, are associated with malignant transformation. So, why malignant transformation is there in case of, if it is associated with HPV infection, suppose inverted papilloma, the transformation of in malignancy may be there if there is a 16 or 18 oncogenic subtype are there, and other thing is same. So, in diagnosis part, a novel diagnostic approach for lesion is the radiomics method. Radiomics means all the radiological methods starting from the CT, MRI, USG, CBCT or simple X-ray, all should be mixed, and AI algorithm is there, so that you can understand the volume and the surface of the tumor and the pathology and the morphology of the tumor you can identify. So, radiomics, yes, and staging. So, this is the staging part, or there is nothing new. Modification of endoscopic medial maxillectomy. Why? So, in case of inverted papilloma, modern treatment of choice is medial maxillectomy. So, there is some modification of technique is there. Pedicle oriented endoscopic surgery, modular classification of endoscopic medial maxillectomy, tuna saving means turbinate and nasolacrimal duct saving technique, and pre-lacrimal approach. These are the modification. Others are same according to the previous. Now, second is the juvenile nasopharyngeal angiopharma. Everything is same. Only is the expression of various growth factors, oncogenic such as c-KIT or c-MYC. These are important. So, and another there is a two type of commonly used classification are there, Andrew-Fix and the Rhinology classification. Treatment including in treatment part, in medical treatment part, there is some technique that is used, IMRT, gamma knife, cyber knife are used in treating the any malignancy inside the nose and inside the brain also. So, there is some technique for gamma knife is a form of stereotactic radiosurgery that used in multiple beam highly focused gamma radiation to treat small and medium sized lesion in a single setup, in a single session. So, and hormonal therapy is there also. Comparative table advancement, this already I discussed. Future trend is artificial intelligence in radiologic diagnosis, gene therapy, HPV vaccine and prophylaxis, and personalized medicine with biomolecular marker. So, conclusion, evolving molecular understanding has redefined therapy, precision diagnosis and target treatment are now available, minimally invasive technique improving prognosis. So, thank you.
Good afternoon. It's an honor, pleasure and privilege to be here. I know you are exhausted, so I'll make it very short so that it will be understandable and take home will be there. So exam is coming, so you need to read exam oriented. That's why I've given few slides that will help you. As we know, rhinology is a very dynamic medical and surgical specialty, because in rhinology we do all medical condition also we practice. So the field of rhinology has gained much scientific acclaim over past few decades, that we all agree. So in 10 minutes I'll try to finish little bit less time. So objective of this presentation, so that we can understand what are the surgical recent advance. I have gone through the last 10-year question paper. So I have seen few points. Kichu bolcho? Huh? Ki bolche? So I have gone through the question paper, that what are the important topic that that is balloon sinuplasty, image guided sinus surgery, endoscopic dilatation of the eustachian tube. These questions are coming alternative here. Laser in rhinology, of course laser in ENT you need to read in detail, and endoscopic nasopharyngectomy. And recent advance is not like that. Anyone can do innovative surgery. It should be accepted, and that become recent advances. So these are the standard procedure, that is balloon sinuplasty. What is balloon sinuplasty? It's a minimally invasive endoscopic procedure where we introduce the guide wire endoscopically to the sinus ostia, and over the guide wire we pass the balloon and inflate and deflate. So details procedure I can't explain right now. So this is the procedure. We endoscopically locate the sinus ostia and introduce the guide wire, and over the guide wire balloon we have to push and inflate. So there are some limitation. Indication, chronic rhinosinusitis without polyposis. But the principle of balloon sinuplasty is that we don't remove the bone or tissue as we remove in face, but in balloon sinuplasty we establish the physiology. That's why with polyposis, malignancy or fungal sinusitis, these are not indicated. But where is the indication? Indication is the like face, the chronic rhinosinusitis with CT evidence. That is the main indication. But contraindication we need to understand malignancy, one of them, cystic fibrosis, allergic fungal sinusitis, that we have to remove the tissue, and CRS with polyposis. So you need to read in detail that balloon sinuplasty. It's a very important topic. Next, and complication, yes, any procedure have complication, as we all know, but since we generated the pressure, if it is in the skull base, it can lead to CSF leak, optic nerve injury, etc. It can occur. Next topic is very, very important, that is image guided surgery. Unfortunately, maximum institute we don't have. That's why if we don't see, we don't understand sometimes. So theoretically we have to understand. So I am not going with the detailed slide. So what is image guided surgery is a very simplified way. We collect the data from the patient, like data means CT, MRI. We upload this data to the computer, and there are some tracker system that we align patient anatomical data and radiological data. So this is the flow chart, that is the image guided surgery. So we transfer the data to the computer, and with video monitor and tracker system we align the patient data and anatomical data. Then with surgical instrument, with probe, we proceed. So this is the flow chart. It's a bit simplified, but you need to read like that, what is the technology, steps to get started, how it started, and clinical indication you need to understand. Where is the indication? Revision surgery. Mainly image guided surgery is important in revision surgery. Extended procedures, skull base surgery. So you need to read all this point. So it's act as a GPS system for an endoscopic sinus surgeon. So used mainly revision, skull base surgery, minimal invasive surgery. So these are the some concept and workflow. This is a big list for indication. I am not going line by line. So any structure beyond the instrument we need to see, then navigation is the answer. Because with endoscope we can see the structure, but beyond that structure, what is the important structure, that to prevent complication, navigation we need to use. So next, navigation in face. So in at Dr. Arindam was telling that navigation in otology. So these are the tool. This is not the recent advance. This is the recent technology. But in surgically, we are the surgeon. Basic is the same. We need to modify. Another condition is the topic is the eustachian tube dilatation, as Dr. Arindam has explained. So it's again, it's obstructive pathology, whether it's patulous pathology. If it is obstructive, then dilatation is the answer. If it is patulous, then we need to do tuboplasty with laser, microdebrider, or sometimes if it is a patulous, then anterolateral aspect of the tube, we need to resect it, and we have to graft with cartilage, so that the patency will be less. So all this thing you need to read, what are the important points, like laser tuboplasty, microdebrider. So these are some tips. We can't complete. And another is very important, narrowband imaging in rhinology. We are using in laryngology, but now narrowband imaging in rhinology also coming up. Here is the basic funda, is that we pass the light with the filter. There is a blue and green light. The basic principle, you read the book, basic principle is that that light is absorbed by the hemoglobin and reflected by the epithelium. So if it is a hypervascularity, absorption will be more. So if there is a hypervascularity, the chance of malignancy will be more. So all this point you need to understand. So principle, I am not going detail about that. So indication, mainly diagnostic, to take differentiation, to take decision whether we will go for biopsy or not, whether this lesion is malignant or not. So preoperative planning we can do with narrowband imaging. So what we do, the mucosal color with endoscopic view and narrowband imaging, we can see the vascularity pattern. Depending on the vascularity pattern, we can diagnose the condition. So there are plenty of data, literature is available, and I have collected one Lalwani, I can give the reference. So these are from books. And another condition is laser in rhinology. So laser in larynx, laser in head neck we are using, but rhinology also coming up. That is CO2 laser, KTP is the contact laser, diode laser. So these are the indication for laser in rhinology. It's a big list. So what are the indication you need to read, and other procedure like with 3D imaging, 3D navigation system we can incorporate the laser. Robotic we can incorporate the laser. So suggested reading, I have gone through the 10 years question. This is also, I have seen this question, materials and technique of augmentation rhinoplasty. So I didn't cover, it's not recent advance, but what are the material, biodegradable material we can use, what are the surgical technique you need to understand. One is application of coblation. Coblation is very common tool, you need to read. Endoscopic hypophysectomy is not recent advance, it's a routine procedure we are doing, but still you need to read all these things. Reduction rhinoplasty and endoscopic CSF leak. So endoscopic CSF leak also is a very common question been asked for last 10 years. So in recent advance is not that what are the tool we can use, what are the different technique we can use. And last but not the least, this is pyriform turbinoplasty. This is first time I am Dr. Anirudh and Professor Robi Hemram in Midnapur Medical College we are doing. This is will come up as a recent advances rhinology surgical technique, that only one surgery, one literature is there from Zurich by Daniel Siemens. So we are doing very religiously to see the objective and subjective result of the surgery. So recent advance is nothing but the accepted, it's a validated technique. After passing, you can also do different innovative surgery, so that it become a recent advance. So, so what are the tool we can use? What are the validated, accepted, whether it's accepted worldwide or not? So then it becomes a recent advance. So with that note, I will conclude. So technology is not substitute, is a technique. Thank you very much.
Thank you. So tomorrow we will start COM at 9:30. It is instead of 10, we will start 9:30. Please remind you that it is 9:30. Tomorrow you will have the breakfast at 9. From the 8:30 you will get the breakfast. And tomorrow we will give you the CME credit hour certificate will be given to you in the tomorrow. Thank you.